What's going on, people? Welcome to Respiratory Shock Therapy. I'm Andrew Sanders, and this is episode 1. So since this is episode 1, I figure I might as well make a quick kind of introduction and talk about my goals really quick behind this video series. So I know we cover a lot of information in lecture, and what I'm doing is recording the lectures and trying to break down some of the most important information, some of the things that the instructors say we're going to be quizzed on. And I might not squeeze everything into these videos because the lectures go on for a pretty long time, but I do want to squeeze in some of the more important things that the instructors talk about, and also I want to put in things that the instructors say will be on the quizzes. And my goal is to try to make a few videos per week, or at least, keep pumping them out on a regular basis. So if you enjoy these videos, if they help you at all, you can subscribe and keep an eye out for future ones. So with that said, let's get started on infection control. So the lecture that we had on infection control was really long. So I'm going to try and break that down into the main points that Josh mentioned we should know, and I'm also going to be going off of the objective list that he submitted onto Canvas. So number 1, we need to be able to define nosocomial infection. And that's pretty straightforward. We talked about it a lot. Nosocomial infection is basically an infection that's acquired in the hospital. Hospital-acquired infection. Next, we need to identify and describe the 3 major elements necessary for the spread of infection. So the 3 elements necessary are a source of the pathogens, a route of transmission, and a susceptible host. Next, we need to define what exogenous and endogenous mean and what the differences are between those. So exogenous infections are coming from outside of the patient's body. So we talked about fomites and vectors and things like that, contaminated surfaces, those are all exogenous. Endogenous come from inside the patient's body. So the patients may infect themselves. They could have bacteria on them that's not really causing them any problems until they're in the hospital, their immune system's compromised, things like that, and suddenly they get sick. Next, let's talk about the most common organisms for nosocomial infection. So bacteria cause the most nosocomial infections, the most common being gram-negative, and the main ones that we mentioned in class are Pseudomonas aeruginosa, Klebsiella pneumoniae, Serratia, Marcescens, Escherichia coli, Enterobacter species, and Proteus species. And then gram-positive cocci amount for some of the nosocomial pneumonia, mainly Streptococcus pneumoniae and Staphylococcus aureus. The next thing we need to know are factors that increase the host's susceptibility. So these are things like poorly controlled diabetes, cancer, lymphoma, leukemia, patients treated with antimicrobials. We talked about corticosteroids that can affect the immune system. There's also immunosuppressive agents. And then we talked about age. So old people, young people have weaker immune systems. And a few other things. We talked about placement of tubes and catheters. These provide, additional routes for infectious agents to enter the body. So as you can see, we're a little over 4 minutes into this video, and we've already covered a ton of information.
It's time to stop! It's time to stop, okay? No more!
But the good thing about videos is you can always go back and rewatch things, and it makes it pretty easy. But let's keep going. So the next thing we need to know are the main modes of transmission. So pathogens are transmitted by 5 major routes: contact, droplet, airborne, vehicle, and vector-borne. So these are good things to know, and I'm just going to break down some of the quick information about these. So contact transmission, There's direct contact and indirect contact. So direct involves physical transfer. So that's like hospital personnel with contaminated hands touching a patient and, transferring pathogens to them directly. Indirect contact is that's between a susceptible host and a contaminated object. So that's when we were talking about fomites and things like that. Clothing, dressings, instruments, equipment, things that have bacterial growth on them that get transmitted to the patient. Droplet transmission, that occurs when a pathogen reaches the mucous membranes of a host, and this is through coughing, sneezing, talking, things like that. These are large contaminated liquid droplets that can only travel about 3 feet maximum. Airborne transmission, those are the smaller ones, tiny little liquid particles, 10 to 100 microns, and these ones can move around the air and travel a lot further than droplets. Next, we talked about vehicle transmission. So we didn't talk much about this because it doesn't apply as much, but examples of vehicle transmission are things like foodborne infections, salmonella, stuff like that, and waterborne infections. And the last one is vector-borne transmission. So this occurs with some kind of animal or insect. Things like ticks, mites, mosquitoes, fleas, rats, all that kind of stuff. If they transmit diseases, those are vector-borne transmissions. All right, so we made it through all 5 of those. Next, we're going to talk about specifically how infection spreads into the lungs. So the 3 major routes that we should know are aspiration, inhalation, and bloodborne. Aspiration is when the patient actually breathes in secretions, oropharyngeal or gastric secretions that get breathed into the lungs, especially on patients with abnormal swallowing mechanisms. Like we talked about, if they were, if the patient's unconscious, things like that, they could breathe things into their lungs. That's aspiration. Inhalation is what we talked about earlier, the droplets, somebody sneezes, things like that, and they get inhaled straight into the lung. And then bloodborne hematogenous infection spreads from a distant site that can also infect the lungs. All right, moving on. So let's talk about control methods. We're supposed to be able to list and describe the infection control methods to break the pattern of the spread of infection. So, the 3 things that we can do to break the pattern of infection are: number 1, decrease the host's susceptibility; number 2, eliminate the source of the pathogens; and number 3, interrupt the routes of transmission. That's when we talk about special equipment handling, disposable equipment, stuff like that, making sure you get rid of those, all that good stuff. Next, we need to identify the specialized equipment handling procedures to prevent the spread of infections. So we talked about cleaning, disinfection, sterilization. We need to be able to differentiate between all of those. So I'm just going to quickly go through those. Let's start with cleaning. Cleaning is the first step in all equipment processing. All non-disposable equipment can be cleaned as a first step. It involves removing dirt and organic material from equipments, usually by washing. And electrical equipment can be wiped down with 70% ethyl or 90% isopropyl alcohol. Now let's talk about disinfection. Disinfection destroys the vegetative form of all pathogens except bacterial spores. It can involve chemical or physical methods. In the hospital, the most common means of physical disinfection is pasteurization, usually using a dishwasher-type machine. Chemical disinfection involves the application of a chemical solution to contaminated surfaces or equipment. And we talked about low-level, intermediate-level, and high-level disinfectants. So we'll go into those really quick. Low-level disinfectants will kill most bacteria and some viruses and fungi, but they don't eliminate resistant microorganisms. such as Mycobacterium tuberculosis, spores, non-lipid viruses, all that stuff. Intermediate level disinfectants will kill vegetative bacteria and fungi, but have variable activity against spores and certain viruses. High-level disinfectants can destroy all microorganisms except bacterial spores. And last, we talked about sterilization. So that destroys all microbial life, both vegetative and spore forms, all bacteria, fungi, yeast, viruses. It destroys all of them. And it can also be achieved with physical and chemical approaches. So steam sterilization, that's the autoclave, is most common and easiest. Alright, so now we're going to talk about identifying the equipment handling procedures that will help prevent the spread of pathogens. So first we're going to list the respiratory care equipment that's most often the cause of nosocomial infections. And we need to describe how to minimize the spread of infection from these devices. So nebulizers, large volume nebulizers, are the worst offenders. Contamination occurs via the use of non-sterile fluids, entrainment of contaminated air, handling of internal parts, backflow of condensate from the delivery tubing into the reservoir, and improper sterilization. Once a large volume nebulizer is inoculated with an organism, within 24 hours the organism can colonize enough to cause an infection in the patient if it's inhaled. And small volume nebulizers can also produce bacteria aerosols. So ventilators can also cause infection. The internal working of ventilators are not common sources of infection, but the external ventilator circuitry poses the most significant contamination risk, particularly in systems using heated humidifiers. The primary problem stems from contaminated condensate in the inspiratory limb of the circuit. Oxygen therapy apparatus, they don't usually cause as many problems except for the non-disposable types. So many hospitals use disposable and they can last up to 6 to 12 days. Okay, so objective number 7, we're supposed to list and describe the use of general barrier methods of infection control. These ones aren't too crazy difficult. So we're talking about hand washing, wearing gloves, wearing masks, gowns, eyewear, face shields, and other items like head covers, booties, beard guards. So we'll break these down really quickly. Hand washing is the single most important way to prevent the spread of infection. So we talked a lot about correctly washing our hands for 15 seconds, all that stuff. We're supposed to wash them after patient contact, even if your gloves were worn, and follow the correct steps.
It's time to stop!
So for gloves, the 3 major reasons to wear gloves are to protect the healthcare worker from contamination from an infected patient, to protect the patient from an infection from a contaminated healthcare worker, and they decrease the likelihood of cross-contamination between patients via caregivers' hands. And then we talked about the different types of gloves. So there are sterile gloves that should be worn whenever we're performing invasive procedures. Masks prevent transmission via the airborne route. They should cover both the nose and the mouth, and they protect the wearer from both large particle aerosol droplets, those are the close contact ones, and from smaller droplet nuclei, the true airborne ones. Alright, so gowns, these protect the clothing and the skin from contamination and soiling. Disposable gowns or freshly cleaned gowns should be worn if soiling is expected, or when the patient has highly contagious organisms such as chickenpox or disseminated herpes, things like that. Gowns should be worn and removed and discarded before leaving the patient's room. Then there's eyewear, like face shields. These protect the eyes and mucous membranes from contact of potentially pathogenic organisms. They also keep you from rubbing your eyes with contaminated hands. So the last thing I want to talk about is surveillance and the key components of a departmental bacteriologic surveillance program. So, surveillance involves equipment processing quality control, routine sampling of in-use equipment, microbial identification, and epidemiological investigation in nosocomial outbreak. So, surveillance is basically the process that ensures that infection control procedures are working, and it's an ongoing process of monitoring patients and healthcare professionals for acquisition of infection and or colonization of pathogens in the healthcare setting. So basically, surveillance is to determine if personnel are complying with policy and procedure, making sure washing their hands and all that stuff. Feel free to comment below, and if you guys want to, start a discussion or anything like that on any additional information that I might have left out, stuff like that, feel free to comment below. And thanks for watching. I'll see you guys next time.